Hello everyone, welcome to mindbraintalks, the place where you find diverse and scientifically accurate information regarding psychology, neuropsychology, neurosciences and research methods every single week. My name is Bruno Faustino. I am a licensed clinical psychologist and neuropsychologist who's been working as a therapist, researcher and educator for the past few years. Here in mindbraintalks, I discuss and describe different topics from psychology to neurosciences, and I try to explain them the best as I can for you to understand and for you to learn something more about it. All discussions here are just for educational purposes, and it's not intended to diagnose any psychiatric condition or neurological disorder. So, without further delay, let's jump for today's content. So, today I'll talk to you about emotional disorders. In the previous video, I showed you what is the transdiagnostic perspective, and now we will see how it can apply to a specific set of disorders that has a similar basis, that has similar etiologies and has similar factors, okay? So, let's go! So, now let's look to the manuals that I recommend to you today. The first is Introduction to Clinical Psychology. The second, the Oxford Handbook of Clinical Psychology. The third, Clinical Psychology Handbook of Psychological Disorders. The fourth, the Transdiagnostic Roadmap to Case Confirmation and Treatment Planning. The fifth is Cognitive Behavioral Processes Across Psychological Disorders, a Transdiagnostic Approach to Research and Treatment. And the sixth, the Unified Protocol for Transdiagnostic Treatment of Emotional Disorders from David Barlow. So, now let's see what is a transdiagnostic approach to emotional disorders. Emotional disorders is a term used to define a cluster of disorders who are primarily focused on the affective domain. It represents different aspects of pervasive emotional symptomatology, and this type of disorders do not have a discrete diagnostic category in DSM-5. These emotional disorders tend to have a neurobiological overlap, such as same genes or different environment tend to foster the same symptoms. So, there is an increased activation on the right hemisphere which is associated with emotional disorders. The corticotrophin release factor, CRF, tends to have some associations with stress, anxiety and depression. Also, in the emotional disorders we tend to see high grades of current of comorbid symptoms, and these symptoms tend to occur during lifetime. And the notion of emotional disorders tend to be supported by transdiagnostic perspectives in treatment protocols and outcomes. Some disorders may overlap in different features, such as processes and mechanisms. This is also supported by similar vulnerability factors, such as genes and environment. Early maladaptive experiences, such as trauma, loss and emotional neglect, which may also foster different emotional disorders. And some disorders may have the same aspects of cognitive, affective, interpersonal and behavioral functioning, which means that maybe the same mechanisms are underlying different emotional disorders. So, examples of emotional disorders may be anxiety spectrum disorders, such as social anxiety, generalized anxiety disorder, or even post-traumatic stress disorder. And depression spectrum disorders, such as major depressive disorder, bipolar disorder, or cyclothymia disorder. Here you have the notion that these kind of emotional disorders are similar, and they all have similar mechanisms underlying. So, an individual who has some emotional trauma may also exhibit some anxiety or some depression. So, emotional disorders are different from schizophrenia, which tends to be defined as a perceptual and thought disorder. Neurodevelopmental disorders such as ADHD. So, emotional disorders is very different from neurodevelopmental disorders. And personality disorders. Emotional disorders tend to be described as Axis 1 disorder, and personality disorders tend to be described as Axis 2 disorders, which is very different. And there are different approaches of clinical psychology and psychotherapy that tend to focus specifically on transdiagnostic features of emotional disorders, such as cognitive behavior-oriented therapies. Typically, cognitive therapy has a diagnostic approach to specific diagnoses and has different approaches to transdiagnostic disorders. Acceptance and commitment therapy and dialectical behavior therapy are two major CBT, third-generation CBTs that are focused specifically on transdiagnostic features of disorders. Schema therapy or emotion-focused therapy, or even paradigmatic complementary meta-model. These kinds of therapies are specifically focused on transdiagnostic or transtheoretical issues of psychological disorders. So, don't worry, in the future I will produce different videos focused on these specific approaches, okay? So, now let's just summarize the contents of today. So, we see that there are different disorders of emotions, and these disorders tend to be described as emotional disorders. The construct of emotional disorders tend to be supported by the overlapping genes, neurobiology, and symptoms. Emotional disorders are very different from the other psychological disorders, such as personality disorder or neurodevelopmental disorders. And we saw that there are different psychotherapies that are focused specifically on transdiagnostic or transtheoretical aspects of these disorders. I know that these concepts may be new to you, and I know that these could also raise some questions. But don't worry, in the future I will produce different videos focused on these issues, and I will try to go deeper on the explanation on these disorders, okay? Don't worry, in the future we have lots of time to study this, okay? Well, it's all for today. Don't forget to see the video's description regarding today's theme in order to see the manuals and the books that I recommend to you. Also, if you like what I'm doing here, please consider to subscribe and hit the bell for notifications. You can use the comment section below to express your thoughts and to express your mind. Let me know what you think about all of this. Welcome to Mind Brain Talks, and I hope to see you in the next video. Bye! Hello everyone, welcome to Mind Brain Talks, the place where you'll find diverse and scientifically accurate information regarding psychology, neuropsychology, neurosciences and research methods every single week. My name is Bruno Faustino. I am a licensed clinical psychologist and neuropsychologist who's been working as a therapist, researcher and educator for the past few years. Here in Mind Brain Talks, I discuss and describe different topics from psychology to neurosciences, and I try to explain them the best as I can for you to understand and for you to learn something more about it. All research here are just for educational purposes, and it's not intended to diagnose any psychiatric condition or neurological disorder. So, without further delay, let's jump for today's content. So, this video is focused on personality disorders according to the DSM-5. I will describe to you what is a personality disorder, and I will also give some specific criteria that clinical psychologists and psychiatrists tend to use to identify and describe a personality disorder, okay? So, let's go. So, a personality disorder is an enduring pattern of inner experience and behavior that deviates markedly from the expectations of the individual's culture. This pattern is manifest in two or more of the following areas: cognition, ways of perceiving and interpreting self and other people; affectivity, the range, intensity, liability and appropriateness of emotional response; 3. Interpersonal functioning; and 4. Impulse control. So, another criteria is the enduring pattern is inflexible and pervasive across a broad range of personal and social situations. The enduring pattern leads to clinical significant distress or impairment in social, occupational, or other important areas of functioning. The pattern is stable and of long duration, and its onset can be traced back to at least to adolescence or early adulthood. The enduring pattern is not better explained as a manifestation or consequence of another mental disorder. The enduring pattern is not attributable to physiological effects of a substance or another medical condition. So, as you are seeing, a personality disorder is defined as a pattern of experience, of emotions, thoughts and behavior that tend to be recurring from the early adolescence to adulthood. Individuals tend to manifest different forms of experience that has maladaptive functions in the self-functioning and interpersonal behavior. Individuals tend to manifest different symptomatology across a lifespan. So now let's look to specific criteria of personality disorders, because there are different major domains of specific personality disorder, okay? So let's look to them right now. So, as I said, personality disorders may be described in three major clusters, which is cluster A, cluster B, and cluster C. Individuals who are diagnosed with a cluster A personality disorder tend to have features of distrust, social detachment, perceptual distortions, and eccentricities of behavior patterns. Typically, we find in this cluster paranoid personality disorder, schizoid personality disorder, and schizotypical personality disorder. Individuals who are diagnosed in cluster B personality disorders tend to have features of disrespectful, emotionally unstable, attention-seeking, and grandiosity or need for admiration. Here we can find 4 personality disorders: antisocial personality disorder, borderline personality disorder, histrionic personality disorder, and narcissistic personality disorder. In cluster C personality disorders, individuals tend to manifest feelings of inadequacy, submissive behavior, and preoccupation with control. Here we can find avoidant personality disorder, dependent personality disorder, and obsessive-compulsive personality disorder. So there are another cluster of personality disorders that tend to manifest with different traits from the other personality disorders. So we can find a personality change due to another medical condition, other unspecified personality disorder, and unspecified personality disorder. These personality disorders tend not to be described as typically similar to the ones that were previously described. So today's video was very short, but don't worry, in the future I will make a more in-depth video when we can look specifically for each personality disorder, okay? This video was just an overview on personality disorders. So if you like this topic, please stay tuned to see the future videos on this, okay? So now let's just summarize the contents of today. We know that now a personality disorder is an enduring pattern of experience that starts in adolescence or early adulthood. Personality disorders may be described in 3 major domains. In cluster A we find paranoid, schizoid, and schizotypical. In cluster B we find antisocial, borderline, histrionic, and narcissistic. And in cluster C we find avoidant, dependent, and obsessive-compulsive. And there are the other domain of personality disorders that typically tend to describe individuals that do not match specifically with these criteria, okay? Well, it's all for today. Don't forget to see the video description regarding today's theme in order to see the manuals and the books that I recommend to you. Also, if you like what I'm doing here, please consider to subscribe and hit the bell for notifications. You may use the comment section below to express your mind and to express your thoughts. Tell me what you think about all of this. Welcome to Mind Brain Talks, and I hope to see you in the next video. Bye!